Thank you for joining me to talk about the basics of sleep and sleep environment while living with a cancer diagnosis. I'm Dr. Kelly Gill, part of the sleep medicine department at Northwestern Medicine Regional Medical Group. Today, we're filming at our office at Northwestern Medicine at Central DuPage Hospital. And if you have any questions during our talk, please just post comments and we will try to get them at the end. So at the beginning, I wanted to start with mentioning that sleep is a very important topic for all of us, and really is reflective of our not just physical well-being, but mental well-being. It's very difficult in the context of having a cancer diagnosis, particularly a new cancer diagnosis, because not only are you dealing with physical issues, treatments, new medications, but you'll also be dealing with stress, anxiety, difficult discussions with family members. And this sort of mental stress, it can also be part of sleep disturbance that would be natural, expected for anyone. So part of it is a little bit of understanding of sleep, acceptance that there will be some disturbances, some changes, but what can we do to try to promote our natural sleep and try to promote the best quality sleep we can achieve? So first, I wanted to start with some very basics in terms of sleep hygiene. So the first, number one tip I would give anybody is to keep an extremely consistent sleep-wake schedule. So a lot of people think they may do that, but what we really mean by this is that your bedtime and rise time should not vary by more than 15 minutes. So meaning having an exact bedtime and an exact time to wake up every day is a very critical part of training our brain to have a sleep schedule, or in what we would call in training our circadian rhythm or biological clock. So what this would mean is even on weekends, not letting ourselves slip into a different sleep schedule, or for people who do wake up frequently at night or have any trouble falling asleep, one trick we often recommend is to set an alarm. So many patients will say, I don't use an alarm, but it's very important to do that because it's part of training our brain to be a better sleeper. So what we recommend is that you set an alarm for when you're going to wake up, which again should be the same every day, and then turn that clock around. So no matter what, if you're awakening or you go to the restroom, don't check what time it is, because that will add to teaching ourselves to wake up at 2, 3 every day. It also adds to what we call hyperarousal of the brain, or our mind is just too turned on, which is really what insomnia is. The other thing we often recommend is just to get rid of any electronic devices that show the time or clock in the room. So even checking the time on an iPhone or an iPad. A lot of people nowadays do use their phone. So if we awaken, the first thing we do is grab that phone. Try not to do that. Resist that urge, because that can just lead to frustration and more worry. And remember, everyone does wake up a little bit during sleep. It's the fact if we start ruminating or worrying persistently about it, in some ways we're creating our own problem. Another thing we often recommend is before you get into the bed to develop a relaxing routine. So again, our bodies are under stress, our mind is under stress, and if we get into the bed with the mind very hyperactive, it's going to be difficult to relax and fall asleep. Another thing to keep in mind is it is normal to take a good 15-30 minutes to fall asleep. So meaning it's not normal to hit the pillow and just be out. That's indicative that maybe you're sleep deprived. So again, not worrying too much. We should lay down, and it should take us 15, 30 minutes to fall asleep. But what we want to do is develop a bit of a relaxing routine. So that could last anywhere from 30 to 60 minutes before you get into that bed. So for example, it could be reading, meditating, a warm shower or bath. Actually is a way of dropping our core body temperature and inducing a deeper sleep in our brain, because part of sleep is actually related to temperature. Keeping the room cool, dark, quiet also will promote better sleep. So again, coming back to developing that relaxing routine, some people will even use herbal oils or essential oils, candles, scents can make a difference in terms of inducing relaxation. A little bit of reading or watching TV in bed is not terrible, but we don't want to get into prolonged periods of reading or watching TV in bed. It'd be better to do it outside the bed and then just get into the bed when we are more relaxed and ready to do so. Another thing we would say is that to try to remove any distractions from that bedroom. So meaning making the bedroom really just for sleep. Again, dark, cool, quiet, but avoiding having pets or little children in the bed if possible. Another recommendation is routine exercise. Doesn't even have to be very prolonged, 15, 20 minutes a day of even mild aerobic exercise, walking, biking, can not just induce deeper sleep, but it adds to that mental relaxation. Not napping during the day. Now, although that's a general rule of thumb for most patients, as you go through cancer treatment and your body may be more fatigued, and as we talked about, you will expect some disturbances to your sleep. So you may actually have that irresistible urge to nap, the need to nap during the day. If that happens, it's okay. Allow yourself to do so, but try to limit those naps if you can to not more than 30, 60 minutes. And the timing would be important. So meaning we would really suggest not to nap after 3 p.m. because we don't want to interfere with the drive to sleep at night. And again, even if we nap or even if we have a bad night, the key is to keep on that exact bedtime and exact rise time. Don't vary from what the normal schedule is. Another suggestion is not to have very large meals, eating, drinking close to bedtime, because acid reflux can really be a hidden trigger of abnormal sleep and awakenings at night. So as much as we can avoid eating at least an hour or two before bed. Another note on that is alcohol. So a lot of people do use alcohol to relax. They feel it helps them sleep. Unfortunately, it's actually a myth. The alcohol will initially help people fall asleep, but typically once it wears off, sleep will become more fragmented and patients will have more awakenings. The other issue is if there is any snoring or breathing issues, alcohol can make that worse because it is a respiratory depressant. Last thing to mention is not to bring our worries to bed. Easier said than done, especially when you're undergoing such a major life change and major stress. One method we often suggest, which actually has documented research behind it, is to make what we would call a worry list. Sometimes it doesn't even have to be a worry list. It might just be a list of things to do the next day, or to journal things that are on your mind. The key is that you want to physically write it down, And you don't want to do it right before bed. We would suggest doing it maybe 2 hours, 3 hours before bed, where you might sit, make a list of things that are on your mind, things to do, appointments, etc. But once you've spent about 15, 30 minutes doing this, you would put it away. What happens then in the middle of the night, or if you lay down and these thoughts start to intrude into our mind, we have to physically say to ourselves, we've put that ideas away, we'll deal with it tomorrow, but we've already thought about it. We've already addressed our thoughts and concerns. Now's time to let the body relax and sleep. And let's see what else. So a couple other questions specific to this topic is, question one was, what basics of sleep should patients diagnosed with cancer know? So again, coming back to what we talked about, keeping that strict sleep-wake schedule, one. Two, one of the difficulties with sleep in our society at this time is the 24/7 hustle and bustle of life today, meaning TV is on 24/7, internet is available 24/7, electronics are all available. So this conscious effort to shut our minds off and to let our bodies relax are important for everyone. So a big part of that, easier said than done, and people often underestimate the amount of electronics they're using, but minimizing those electronics at least 2 to 3 hours before bed is really essential part of relaxation. TV, reading are very different forms of stimulus because they don't have the same intensity of light as an iPad or a phone has. But also it's not as quite stimulating as, again, a computer or electronic device. So really shutting those electronics off as soon, to shut them off as far away from our sleep time as possible is very beneficial. So again, using electronics at the right time, I would say, is critical, keeping that regular schedule. And again, an awareness and acceptance. Everybody wakes up at night. Everyone has a little bit of difficulty, not focusing too much on that. Again, we talked about some of the sleep improvement techniques. Again, most critical is creating a sleep environment in your room. So, perhaps once you get that cancer diagnosis, reevaluating the bedroom, making sure that we eliminate distractions. If possible, eliminating a TV from the bedroom. Not mandatory, but if possible, that can be beneficial. And then another question is, are there any safe sleep medications patients can take while undergoing cancer treatment? And I would say yes. Now, those do have to be tailored to you. There are definitely a variety of sleep medications that we prescribe pretty routinely. That is something you'd have to talk about with your physician in terms of what would mix with your other medications, what are going to be right for you. Some medications are more focused towards anxiety. Some, actually, we often use antidepressants, anti-anxiety medications for patients who even are not depressed or anxious, but because they can induce deeper sleep without being habit forming. Sometimes we do use pure sleeping medications, and again, that doesn't have to be forever. Sometimes that can be temporary while we're undergoing treatment or undergoing more stress. Sometimes we use other medications, nerve-type medications, for example, that can help issues like neuropathy or pain that may develop as part of the cancer treatment. What causes most of sleep issues in patients undergoing cancer treatment? And I would say psychological stress and the physical stress. The other issue, of course, is that depending on your treatment, you're having to change your schedule and your routines. So that's where, again, keeping our sleep routine as consistent as possible is very helpful, and adding even a little bit of exercise, yoga, stretching, meditation, doesn't even have to be major, very long, can be extremely helpful. And then I guess I'll take questions. Unless you wanted me to talk a little more. Okay.
One question
Yeah.
that I have is, acupuncture is something that can help with insomnia.
Yeah, I think it does have some positive research behind it. And I think so one comment I would make as a neurologist is that I often find muscle tension can be a big part of insomnia. And so why is that? Well, certainly pain can cause us to awaken. But people who might have a little bit of anxiety, more tension, we tend to tighten our muscles and develop kind of chronic muscle tension. And I think just an awareness of muscle tension is critical for actually all of us. And coming back to the computers, like all of us in front of computers and using mouses and everything all day. So for everyone, things like stretching, heat, massage are extremely important. And that's, again, where exercise can come in. Acupuncture could be certainly part of that. I think where the benefit is the release of muscle tension.
Okay. Are there any changes in one's diet that could help improve sleep? And I know you talked about not eating a heavy meal 2 hours or so before sleep, but what about just in general day to day?
I don't think we have a lot of strong evidence on like specific diet things, but depending on the person, what I will say, and I don't have a lot of research behind this, but I do have some patients, I hear this quite often, where they often find sweets or high carbs close to bedtime disturbs their sleep. So that's one comment. Again, not heavy meals close to bedtime, but for some people, depending on your body, your rhythm, light snacks, maybe an hour or two before bed, could be a little beneficial. So maybe like a little bit of crackers or something kind of light that you might have. And if you were truly hungry, though, maybe a light snack could be beneficial. I would say, though, high protein diet, less carbs, lots of vegetables, and of course, I am a big believer in vitamin C and vitamin D in terms of promoting our immune system and our overall health. So I would say, again, lots of vegetables, green leafy stuff. Protein is always good, only because maintaining our energy level through the day. And, actually that's one comment I'd make, because we have certainly seen many cancer patients in our clinic. The weight changes that can happen, and for those that maybe are struggling with maintaining their weight or losing weight, so sometimes protein shakes could be an idea just to maintain their energy level and nutrition through the day. But yeah, not too many sweets, junk food, of course, and carbs, because that oil and grease will add to sort of daytime fatigue.
And there has been a lot of promotion about weighted blankets.
Yeah.
And so what is your thought on a weighted blanket? And
I don't even know how much actual research is behind it, but I would tell you I often recommend it. And I think it comes back to this muscle tension issue. So one, it often can relieve muscle tension. Two, it can relax certain people. Now, some people don't find it relaxing, but it's a relaxation method and many people find it. Now, relaxing. What's interesting about it is you can find different weights available. So there are lower weights, higher weights. I would suggest starting lower. But another note is that I treat a lot of patients with restless leg syndrome, and it can be very beneficial. Those are the patients I definitely recommend it the most for. There's actually these sort of older medical videos where they show severe restless leg patients taking baseball bats to their legs and hitting them, but just because they get a little pressure against the leg, it is part of the relief of the symptoms. So that's where that pressure and the blanket weight can often alleviate those symptoms. And unfortunately, coming back to the cancer treatment, if people are dealing with anemia, because we know that restless legs has a lot to do with iron metabolism in the brain. So maybe you're not normally anemic, but maybe you're dealing with anemia as your body is going through changes. You might develop some restless leg symptoms. Those patients who do develop any types of neuropathy or nerve issues might really benefit from a weighted blanket. And we always want to incorporate any natural methods in all of our patients. It doesn't matter whether we're dealing with insomnia or restless legs or sleep apnea. We always have to incorporate behavioral change, but as many natural changes as we can. And that's one reason it's very worth it to try, because we're talking about something that's not medication. Yeah.
And when should somebody see a sleep specialist?
So for me, it's one if we're at a point of maybe needing prescription medication for sleep. Now, I will say many times perhaps a primary doctor or an oncologist might be comfortable with that. Or perhaps maybe you tried a few and they didn't work, or we're always happy to see, and I know sleep specialists around the country will be happy to see anyone. And then, of course, if you're worried about sleep disordered breathing, meaning snoring or sleep apnea, or oxygenation issues.
A question has come in, and that is, someone's asking, I have no problem with falling asleep, but I wake up several times a night and sometimes can fall asleep again, but more often than not, I wake up at 3 a.m. and I'm fully awake. Any suggestions?
Yeah, so one thing I would say, I have a lot of patients with that same scenario who will say to me, I don't have insomnia. I will say you do, because insomnia is anyone who's having trouble falling asleep or staying asleep for over a month, and it's affecting your daytime functioning. So one thing, part of controlling our sleep, is getting a little bit of a feel of knowing, am I a morning person or a night person? Because we all have a bit of an internal clock in the brain that's extremely genetic and individual. Quick side note is that there's been a lot of major research in the past few years identifying actual genetic markers that identify these genes that control, again, are we morning or night people? But a lot of times people who are more morning people will say, oh, I wake up early in the morning, I just can't go to stay awake, but I fall asleep no problem. And those people always try to sleep in later. Never will happen. The key is you have to go to bed earlier. So you want to change, again, your sleep schedule based on what your natural circadian rhythm or biological clock is. And that can change. Good and bad as we age, perhaps we might become earlier people. So the key with that situation is to go to bed earlier, not let yourself falling asleep on the sofa or watching TV. Maybe set an alarm for 4 in the morning, which can be painful, turn that clock around. And then at 4, just get up and start your day. Then, again, get into the rhythm of going to bed earlier. If you can go with what's more natural, your body will start to fall into line. And like I said, do not check that time if you're awakening at night. So you have to retrain that brain.